Today, good medical practice requires equipment that can provide the utmost protection for ourselves and our patients, and at the same time can reduce the overall costs of care. The Safeset blood sampling system from Abbott meets all these requirements and offers benefits that aren't available with any other system. This program will introduce the system and demonstrate how to use Safeset to reduce the risk and easily obtain blood samples. First, we'll look at the system itself. With Safeset, you reduce the risk of nosocomial infection because the system is entirely closed. The internal sheath guards against touch contamination, and the hard exterior case protects the internal sheath from removal and laceration. The polycarbonate Safeset reservoir ensures that the internal sheath cannot be punctured, not even by a needle. Safeset minimizes a major source of clinician risk, exposure to blood waste. The inline reservoir allows the clinician to aspirate blood that would otherwise be discarded, and later safely return the reserved blood to the patient. This avoids direct clinician exposure to blood waste and eliminates the cost associated with blood discard. Moreover, because Safeset uses blunt cannulas instead of needles, the risk of needle sticks is minimized. Safeset is the only inline blood sampling system that protects itself, protects you, and protects your patients with a truly impenetrable case. In addition, Safeset is available either with a single port close to the patient or with a second port nearer the reservoir for more convenient use during surgical procedures. Another feature of Safeset is its 12 cc reservoir volume. This large volume capacity makes the Safeset system ideal for use in the OR environment. Both the 18-gauge blunt cannula and the Abbott shielded cannula are compatible with the system. The shielded blunt cannula further protects the clinician from blood exposure. Finally, the Abbott shielded cannulas can be used with a standard sampling syringe and are available pre-packaged for convenience with a blood tube holder for sample collection. Now we'll demonstrate how to set up and use the Safeset system. First, ensure that all connections are secure. Before priming and setup, pull back on the Safeset plunger once or twice to ensure smooth operation. Set up and prime the administration set and transducer according to the normal operating procedure as detailed in the product instructions. Once the administration set and transducer have been properly primed, remove the white cover at the patient connector to prepare to flush the patient line. Pull back the plunger slightly and hold the inline reservoir upright with the stopcock at the top while activating the flush device. Check for bubbles when the reservoir is partly filled. If any bubbles have appeared, simply tap the reservoir to dislodge, as you would with a standard arterial line kit. Return the plunger to the locked position and continue to flush until all air is cleared from the system. This reduces the risk of air emboli and ensures optimal dynamic response. Once again, check the reservoir and sampling ports to ensure no air bubbles are visible. If air is visible, hold the system upright and tap firmly to dislodge bubbles. Next, attach the male lure to the patient's catheter and your setup is complete. In order to use the Safeset system, first release the locking mechanism of the Safeset inline reservoir plunger clip by pressing in on the ridged areas. Hold the reservoir and pull back on the plunger slightly to draw dead space fluid into the reservoir. Be careful to fill the reservoir no faster than 1 cc per second for normal-sized catheters, or even slower for small diameter catheters. This avoids occlusion of the catheter and also prevents blood gases from forming bubbles in the reservoir. You need to aspirate an adequate volume of blood to ensure you collect a clean sample. To determine the appropriate volume for aspiration, note when the blood reaches the port from which you will draw your clean sample. Then note the volume in the reservoir. and multiply the reservoir volume times 4. If the volume is between marks, round up, multiply by 4, and continue to fill until that volume is contained in the reservoir. Once an appropriate volume of blood has been aspirated, turn off the one-way stopcock at the tip of the reservoir. This will ensure that you draw a clean sample from the patient and not from the reservoir. In accordance with hospital policy, use disinfectant to cleanse the Safeset port from which the sample will be drawn. Then attach a Safeset blunt cannula or shielded blunt cannula to the collection device. Simply insert the blunt cannula into the cleansed Safeset sampling port and aspirate the necessary amount of blood for the sample into the blood collection device. Note how the slots in the cannula's shield fit securely over the port. If you can access the one-way stopcock between the sampling port and the patient, turn it to the off position. This prevents the patient's arterial pressure from pushing any blood through the port when you withdraw the cannula. When you remove the blunt cannula from the port, even though the port remains sealed, negative pressure could pull a drop of blood out of the collection device. To avoid this, you need to aspirate the sampling syringe slightly while removing the blunt cannula and syringe from the sampling port as a single unit. Then, turn both the one-way stopcock at the tip of the reservoir and the one-way stopcock near the patient back to the on position. Finally, return the reserve fluid from the inline reservoir to the patient by slowly pressing down on the plunger. Return about 1 cc per second until the plunger reaches its locked position. Once the Safeset inline reservoir is in the locked position, activate the flush device until the line is clear of all blood. Overall, once the Safeset inline reservoir is set up, obtaining a blood sample is done in just 3 basic steps. 1. Draw back a reserve volume of blood. 2. Draw the blood sample. And 3. Return the reserve blood to the patient. Throughout the procedure, you and your patient are protected by an entirely closed system, housed in a case that cannot be defeated in normal use. With Safeset, the risk of contamination is minimized, and the costs of discard are eliminated. There is no blood waste. Instead, you have a streamlined, easy-to-use, fully protected system to meet all your blood sampling needs. For further information, or if you have any questions, please contact your Abbott representative.